the CEO of HMI, Chin Wei Jia. Welcome. Great to have you with us.
Thank you. Good morning, Glenn. Good morning, Neil.
I'm sorry, I'm a bit tongue-tied this morning on saying HMI.
Yeah.
Oh boy, I apologize for that. Tell us about HMI and what you do.
HMI, we're a healthcare services company with hospitals, specialist centers, clinics, and of course our social enterprise, HMI Institute. We're in Singapore and Malaysia with presence around the region. So we're pretty much a healthcare company, but we believe that what we can do so much more for the community, and therefore our institute, the HMI Institute, where we celebrated our 20th anniversary just on Monday.
Wonderful.
Well, congratulations.
And I believe you're Singapore's first dedicated healthcare training provider. What does that mean, and what do you actually do?
Well, we've been doing this for the past 20 years. So our social mission is really together building a healthier society. So through the Institute, we are actually doing a lot of training for people who are interested to enter healthcare as a profession, as well as working with healthcare organizations, from the acute to step-down sectors, to train people to upgrade in their careers. So very, very focused on healthcare education and training.
Wonderful.
And this, you have some new initiatives that are helping home caregivers. And
Absolutely.
We know that, many people do have generations of family members in the home. First of all, do we have any statistics on how many people are caring for elders, let's say, for example, or special needs family members?
Great question. I think when we became a social enterprise and really focus our efforts behind it, we actually looked around the market and we're trying to see where the gaps were. Right. We're a healthcare services provider. So we know that when the patients are in the hospital or in the clinic, we have the doctors and nurses to take care of them. In Singapore alone, we have about 15,000 doctors, 43,000 nurses and midwives. And the estimation by CNA last year was that there are about 210,000 caregivers. At home.
210,000.
Yeah.
Wow.
So
there's at least 210,000 people needing help, but probably more, right?
Yes.
Yeah,
absolutely. So we felt that there's just so much more that we can do because we train professional healthcare personnel, and we're taking some of that knowledge, repurposing it so that it's easier and easier understandable, right, by people without healthcare experience, so that they can better care for their loved ones at home.
This is wonderful.
Yeah.
I mean, my mother is a full-time home caregiver for my stepfather. You've had experience of this, of course, with
my mom and
with
my
your
dad.
mum and everything. It's a wonderful thing. 210,000 people are in a similar situation. And who are these people? Are they domestic helpers? Are they relatives? Are they all of the above?
It's a full range. Yeah, I think it's all of the above. But what we felt was that I had the benefit, right, of working in healthcare and really, learning so much from doctors, nurses, physiotherapists, dietitians. And this is some of the knowledge that we hope to share through our Care Buddy community initiative.
Fantastic. We're speaking with Chin Wei Jia, the group CEO of HMI Institute of Health Sciences, about some new programs to train in-home care providers. Give us an example. Let's say I am taking care of an elder parent. What can I access from HMI to learn more about how to do that better?
Yeah, well, of course, we have formal training programs. So that's something that's completely separate. The Care Buddy Community Initiative is something that we're doing for the community, with the community, right, and free of charge, accessible to the general public.
Wow, that's great.
That's really our part of giving back to society. So, outside of the formal training programs, which I just listed on our website, we are actually going to be developing an online platform called Care Buddy. So it's carebuddy.co. And that's something that we're going to launch officially next year. But in the meantime, we do have some health information on it, but we are actually developing this site together with partners. For example, the Singapore Hospice Council, NKF, the National Kidney Foundation, Dementia Singapore, and actually many more, including our own healthcare facilities, One Care Medical and StarMed Specialist Center. So we're actually getting doctors, nurses, allied health professionals who are passionate right, about sharing their knowledge, to come on board, share information, and hopefully reach out to as many people as we can.
What do these free courses look like? For
Yeah.
example, my mother has dementia,
Yes.
and I'm caring for her.
Yeah.
How long is the course? What does it you know, not necessarily what does it cover, but you could tell us that too.
Yeah. So what we're going to be doing is like three things. Okay. First, we're going to create this online platform with
carebuddy.co.
Yes, carebuddy.co. We're going to like put content, training content, videos, articles, you know, all that kind of information for things all the way from the activities of daily living. How do you support that as a caregiver, to things about caregiver support, mental, you know, well-being, and other types of topics. So that's going to be online. We're going to be working with our partners in the communities, the social service organizations, to roll out training for volunteers, so that, you know, we're really in the community, in the neighborhoods. And those will be like, you know, short training programs to give caregivers that overview and information of what they should know or what they should ask, right? The
So is it
healthcare
like an hour
professionals.
program, 2 hours, a half day?
It will range, right, from, you know, just short health talks, all the way up to actual training programs.
That's wonderful. I mean, I imagine lots and lots of caregivers would benefit from this, particularly those listening right now. But they may be thinking, to Glenn's point, time is the most precious commodity they have.
They probably have to be caring for the person themselves, right?
I'm trying to think of my mother. She would think, yeah, I'd love to do it, but I don't know where I would find the time.
How do you get away?
How would that work? How does it look?
Yeah, I mean, we when we looked at this, you know, we also recognize that a lot of caregivers just are not able to leave, right, the home, for any extended period of time. So what we're going to be doing is actually through carebuddy.co, we're going to be like hosting like talks, right, online, you know, easily accessible on your handphone. Then of course community training programs and all that for people who can, you know, find the time to come out. And yeah, that's something that we're just hoping to do. And our internal target is really, can we reach out, you know, to 100,000 people in Singapore, whether they're formal caregivers or maybe they're just supporting the caregivers in their families. I think more knowledge, more skills will empower people, allow them to stay independent for as long as possible, because that's a very key concept that we're trying to promote. Right. And instead of trying to take over everything, of course, in the cases where it's possible, right, help, you know, your loved one, you know, maintain their independence. Help them keep, you know, their skills, their you know, do their daily activities. You know, how do you change the environment around them, right, to enable and motivate. Right, because actually, I mean, of course, caregivers are a very wide range. It's very hard for us to address every single one's individual needs. So we are going to start really focusing on, you know, elderly care, aged care. And of course, over time, we'll expand that to other segments of caregivers as well.
Well, that ties in nicely. Pin Chia, one of our listeners, has said, I lost weight caring for my father when my helper went on home leave. Very serious issue. I'm glad you brought it up. Aging population is arguably the #1 social issue we have in Singapore, dealing with the elderly in society. You did say there that there are many different symptoms and illnesses, could be dementia, Alzheimer's, loss of physical mobility. So broadly, when you're dealing with the elderly, what key areas do you look at?
So we look at, like, you know, I guess when in healthcare, we always focus on quality of care. Right. So that's, you know, medical, it's healthcare related. And that's something, I guess, you know, the healthcare organizations and the healthcare professionals are trained to do. I think what we're trying to also promote, you know, within the informal care sector, right, which is actually people at home, is really focusing on, of course, quality of care, you know, following, you know, the instructions that the doctors and nurses give them, but to really focus on quality of life. Right. And when we look at quality of life, we look at different dimensions. We look at physical, right? Physical health. We look at mental, we look at social, and we look at functional. Yeah. So can you do the things that you normally do? Right. And, you know, I guess, you know, not to be too healthcare about this, but in healthcare, we do look at, you know, activities of daily living. There's scoring behind it so that, you know, the care providers will actually know what support, right, that the care recipient will need. So that's something that we're trying to break down into more simple straightforward, non-healthcare jargon way.
Right.
And that's something that we are working with, the partners that I shared earlier, right? To pull the knowledge together and to put it in a way that is much easier to understand from somebody without any healthcare training.
We're in conversation with the Chin Wei Jia, Group CEO of HMI Institute of Health Sciences. The hard question that comes up is, at a certain point, people need more help than they can get at home, even from a qualified healthcare giver. Do you offer any kind of advice or structure to help people make that decision when enough is enough? For example, we often see older couples caring for each other, and becoming codependent, and many times that is honestly a recipe for disaster, because as you're older, you just don't have the energy, and the wife's taking care of the husband, or vice versa. I saw this happen with my own parents, and it was just hard to get them to move into a facility to get that sort of help. In these new programs, is there a segment where you are helping people understand or recognize some of the signs of, hey, when it's time to make a harder decision about where somebody's going to live?
Well, I think, for us, as healthcare providers ourselves, I'll say a lot of times, have that conversation with your doctor or your nurse, right, on what your loved one can or cannot do. Right. And they will share with you advice, because it's just, like what Neil said earlier, they know the range of support that's needed is actually very broad, and it's really hard to pinpoint. So my own advice, and what I do with my own family members, right, is really we sit down, we talk together, we get inputs of the doctors that care for them, right, and then
advice.
Collectively, just have an open conversation. I know it's easier said than done, because everyone has their opinion. However,
sometimes
I think
the elders are quite resistant. They don't want to move to a facility or someplace, right? They want to stay at home.
Exactly. And if you are able, right, to fulfill the wishes, right, of your parent or grandparent to do what they want, then how do you modify the environment? How do you bring in trained help, or how do you train yourself, right, to play that support role, and then work with home care providers or others to supplement, right, so that they can also help make sure that appropriate care is actually being delivered. So it's really a multifactorial discussion, and having gone through that personally myself, I know how difficult it can be, but at the same time also how important it is. And it's not just one conversation, it's actually conversations over a period of time.
Yeah, you mentioned earlier about volunteers that you'd like to get involved with a social enterprise. I'm sure hopefully some folks listening might want to get involved with such a worthwhile thing. What does that look like, this volunteer sign-up contribution? How does that look?
Well, what we're hoping to do is through, a lot of the social service organizations on the ground, we want to actually reach out to a pool of volunteers. We want to train them to be trainers. Because I think, if we want to, touch, 100,000 lives, that's something where we actually need, a really big, like, ground up movement. And so we're going to do trainers. We're going to train volunteers directly. We're also going to be training caregivers directly. And, because all caregivers have different needs for information and knowledge, right? What one caregiver needs will be different from what somebody else needs. So we're going to do short programs, talks, things like that. If you're interested, please definitely reach out to us. Go to our HMI Institute website, to find out more about what we're doing, and reach out to us. We'll be more than happy to work with organizations or individuals, right, to spread this message.
And just finally, briefly, if I'm listening right now, I think I need a bit of help with my parents. Where should I go first to get this ball rolling?
Well, I think first of all, go to your healthcare professional. I think that's always the best advice as a first step. And if you are looking just for general knowledge to support yourself, carebuddy.co right now has some articles, but we're actually still developing the site with our partners. It's going to be launched next year. But in the meantime, if you want to really learn skills like how to do it, we have courses on that on the HMI Institute website.
So it's HMI-IHS.com?
That's correct.
Yeah. HMI. Okay, awesome. Hey, thank you very much. Such an important topic in our aging society, and one that often we as lay people just don't know how to deal with these issues. So it's great to have a resource like
Yeah.
yours.
And I just want to thank you for such a positive, uplifting story after what's been a difficult first hour. So thank you. We've got some positive news in the community. We love it.
Indeed. Chin Wei Jia, Group CEO of HMI. Thanks for being with us on Money FM.
Thank you so much.
Yeah.